Hello, my name is Megan Leonard, and this is my case study development for advanced clinical procedures. For my patient profile, I have Tammy Tortilla. She is a 59-year-old female. She did not grow up going to the dentist. It was not a priority for her. She has severe periodontal disease and is currently going through menopause. She has a poor attitude about dental care. Tammy is a social drinker, a 2-pack-a-day smoker, a server at Waffle House, and has no dental insurance but does have Medicare. She is a high school dropout and has recently been diagnosed with depression. Tammy lives with her 79-year-old mother and her 4 children, ages 18, 16, 11, and 9. Medical overview. The disease Tammy presents with is periodontal disease and depression. She also is menopausal. Tammy is allergic to amoxicillin and latex. Her vitals, however, are within normal limits at 128/92 for her blood pressure. Her pulse is 74, her respiration is 10, and her temperature is a little high at 99 degrees. Her medical overview continued. Tammy is a Class 2 ASA. She has had 2 C-sections with her last 2 children in 2005 and 2007, and she's only been hospitalized for the 4 pregnancies. Tammy is currently seeing her primary care physician for menopause, and she is on 2 medications, estriadol and sertraline. This patient sometimes goes to the health department in her city and speaks to the psychologist for her depression. For medical emergencies, she may experience hot flash and/or anxiety. Orally, you can find menopausal gingivostomatitis, xerostomia, and candidiasis. The 2 medications my patient is on are Zoloft and Clemera. Zoloft treatment should be initiated with a dose of 25 milligrams once daily, and after 1 week the dose should be increased to 50 milligrams once daily. This is a medication for depression. You should not use Zoloft if you are taking Pimozide or if you are being treated with methylene blue injection. And the oral effects of this medication can include xerostomia, uncontrollable thirst, or red or purple spots on the gingiva. The second medication this patient is on is Clemera. This medication can cause yeast overgrowth or trouble swallowing in the oral cavity, as well as xerostomia. Dental overview. During the intraoral and extraoral assessment, the following findings were noted. Face, head, and neck. This patient has a pale pallor, extensive facial wrinkling. For her lymph nodes, they are palpable on the left side and in the submandibular region. TMJ has crepitus and deviation bilaterally. Her lips have loss of vermilion border and angular colitis. For the mucosa and alveolar ridge, we note lichen planus, keratinized buccal mucosa that is peral and has a shiny erythematous appearance. And as far as her palate and oral pharynx, it is keratinized and nicotine stomatitis and oral candidiasis is noted. Her tongue is fissured and coated. Calculus is heavy and generalized throughout the dentition. Plaque is heavy and generalized throughout the dentition. Stain is heavy on the lingual surfaces from smoking. And bleeding, there's slight bleeding upon probing in the upper right quadrant. PSR and dental charting. This patient has generalized 7 and 8 millimeter pockets, 3 to 4 millimeters of attachment lost. Recession is present in all of the anterior teeth. She has 2 surface fillings, and the missing teeth are 1, 5, 15, 16, 17, 21, and 32. She does have active decay on 13 and 14, and anterior teeth 6 and 7 have incisal fractures. I did note an oral lesion on the posterior border of the tongue. Gingival assessment. During the intraoral and extraoral exam, I did a gingival assessment for this patient. I noted gingival color, gingival contour, gingival consistency, and gingival texture. On to the next slide, I have transferred it into a gingival statement. For the gingival color, the gingiva is pale, shiny, and erythematous. The color is generalized and diffused throughout the dentition and is severe. As far as the contour has been altered, the gingiva has receded severely and the margins are flattened. This condition is moderate in severity, diffused, and generalized. For the consistency, the gingiva is generalized firm and cyanotic. This condition is severe and generalized in the whole dentition. There are localized areas of mandibular facial tissue that are spongy and have papillary distribution. The texture. The disease modified by hormonal factors in this patient have shown generalized diffuse distribution of severe, smooth, and shiny tissue. Loss of stippling is generalized and severe. Localized maxillary anteriors has severe signs of menopausal gingiva stomatitis. Here I provided 6 dental or gingival images for my patient. In the first one, we note generalized severe recession and blunted shaped gingiva. The second radiographic picture shows a class 4 furcation. The third shows the fibrotic tissue that bleeds easily upon probing. The fourth shows the heavy stain due to my patient being a 2-pack-a-day smoker. The fifth shows the nicotine stomatitis on the palate and pharynx of this patient. And the last picture shows the heavy calculus and plaque deposits acquired over the years of neglect. Periodontal assessment. Here I noted my probing depths, my bleeding points, furcation, mobility, and also suppuration. During the intraoral exam, this patient can be classified by their periodontal conditions. This patient presents with generalized class 3 periodontitis in 72% of her dentition. Generalized areas of pockets in both arches, class 2 furcations are present on number 3, 14, 18, 19, and 20. Class 1 mobility is noted on 4, 6, 7, 8, and 9. These areas have moderate bone loss and clinical attachment loss. The patient also presents with class 4 severe periodontitis on 29% of her dentition. These areas have severe attachment loss and bone loss. The class 4 furcations are located on 30 and 31, and class 3 mobilities on 30, 31, and 29. This patient also presents with plaque-induced lesions as well as the factors modified by the menopausal hormones. She has generalized chronic periodontitis and localized severe aggressive periodontitis. There's also an endodontic lesion present at the apices of tooth 31. Dental hygiene diagnosis. The prognosis for this patient is questionable in the areas of the localized class 4 periodontitis. The generalized areas of class 3 have a poor prognosis due to the moderate bone loss and the class 1 mobilities. This patient will have a difficult time cleaning these areas. Short-term goals. For the patient, I want the patient to become motivated about oral health and start a daily brushing and flossing routine. For myself, I would like to continue to educate my patient about oral health and be a source of information they can trust and come to when they have questions. Long-term goals for my patient include completely transforming their attitude about oral hygiene, saving the remaining teeth and complying with myself and the doctor's recommendations, establishing good oral habits for the remainder of her life. My long-term goals would be to arrest the bone loss, control the biofilm and calculus buildup, and prevent future infection by maintaining 2 to 3 month recalls. The modifiable factors with this patient are the behavior and attitude, their knowledge about dental hygiene, their home care, habits, and the frequency of appointments. Also, the ability to stop current infections. The non-modifiable factors in this patient are the bone loss and attachment that has already occurred and the years of neglect the dentist already went through, the missing teeth because the patient could not afford implants, and the furcations with a severely reduced gingiva. Treatment plan and progress notes. For my first appointment, I will take vitals, review the health history, have the dentist do a comprehensive exam where he recommends extraction of 31 to restore 6, 7, 13, and 14, and I would also refer the patient to a periodontist if patient was interested in a gingivectomy or a graft. I would give the patient OHI, explain the disease process, full mouth probe, dental charting, and take an FMX. Determine at this appointment that the patient needs 4 quads of SRP. Local anesthetic is not contraindicated, so we can administer lidocaine with epi and complete 2 quads of SRP at the first appointment. We can subgingival irrigate the upper right and lower right quadrants along with placement of Arrestin in the pockets that are over 5 millimeters. My ADA codes for today's appointment are 0210, 4342, 4921, 4381, and 1330. My progress notes for the first appointment are as follows. Patient arrived 15 minutes late, seemed nervous. Reviewed medical history, patient has depression and is going through menopause. Vitals were within normal limits. Dr. Dentist performed comprehensive exam and determined 31 needed extraction and 7, 6, 13, and 14 can be restored. Patient is uneducated about oral hygiene but seems interested. She says her 18-year-old daughter made her come in today due to pain around tooth number 31. Took a digital FMX intraorally. Patient presents with nicotine stomatitis, xerostomia, and halitosis. After full mouth probe, determined that patient needed the full mouth SRP and explained to her why. She agreed and seemed to relax a little. Administered lidocaine 2% with epi. For the IA PSA on the right side, the patient tolerated the anesthetic well. Subgingival irrigation and instructed patient to take 600 milligrams of ibuprofen for pain until her next visit. Treatment plan for the second appointment. At the second appointment, I would complete the SRP on the upper left and lower left quadrants, subgingival irrigation on those quadrants, and place Arrestin on pockets over 5 millimeters. I would give the patient the home care bag and reinforce OHI and instructions. If the patient has any pain following the completion of her scaling and root planning, I would instruct her to swish with salt water and take ibuprofen. The same ADA codes would be used for insurance billing 4342, 4921, and 4381. My progress notes for the second appointment are as follows. Patient arrived on time and was seated promptly. Vitals within normal limits, but no changes in health history. Briefly reminded patient about deep cleaning and answered questions. Administered 3 carpules of lidocaine with epi at PSA, MSA, IA, and lingual. Patient responded well and proceeded to scale and root plane upper left and lower left quadrants with Cavitron and hand scaling. Subgingival irrigation, placed Arrestin at pockets over 5 millimeters, gave patient recommendation of wide space proxa brushes to keep furcations and embrasures clean. The third appointment for this patient would be for the doctor to perform his treatment. Since he recommended extraction of 31 and composite restorations on 6 and 7, he will do those on the third appointment since he will have to numb the right side. The ADA codes for this appointment are 7140 and 2331. Progress notes for the patient's third appointment are as follows. Vitals within normal limits. Asked patient if she was nervous. She states she was fine, but let's get this over with. administered Septicane 3% for the MSA and IA on the right side, and Dr. Dentist performed extraction of 31 and facial incisal composite resin on 6 and 7. Patient is very pleased with her new smile since SRP and fillings, again reminded her of importance of OHI, and gave her post-op instructions for the extraction. Appointment 4, Treatment Plan and Progress Notes. At the 4th appointment, the doctor will finish the restorative needs for this patient, which is an MOL composite resin on 13 and 14. My progress notes for appointment 4 are as follows. Vitals within normal limits. Patient seems more relaxed at each appointment. No changes in health history. Halitosis is decreasing due to improved oral hygiene. Administered Septicane at MSA, and Dr. Dentist used packable composite resin to restore incisal edge. I gave patient post-op instructions and told her not to chew on the top right side for a couple of hours. Patient is still extremely happy with all services provided and seems motivated about her oral health and keeping her smile pretty. I talked to the patient about the connection between menopause and periodontitis, also menopause and osteoporosis, and again expressed the importance of oral hygiene. I sent the patient home with more floss, mouth rinse, and Biotine for xerostomia. The next visit is a 6-week perio maintenance. Appointment 5. At this appointment 5, the treatment will include a 6-week perio evaluation after her SRP was completed, a full mouth probe, tobacco cessation, perio maintenance, polish and fluoride treatment with the ADA codes 0274, 4910, 1330, and 1320. My progress notes for this appointment 5 are as follows. Patient arrived with 18-year-old daughter. Did not seem nervous at all. Reviewed medical history, no changes and no chief complaint. Patient is pleased with clean teeth and new smile. Went over OHI again and had patient demonstrate how she's brushing with her new spin brush. Performed full mouth probing. Generally, there is a 1 millimeter increase in the anterior pocket depths, but no deeper pockets or greater diseased tissue. Took bite wings and performed perio maintenance. Polished, flossed, and applied Vela Varnish fluoride treatment. Tobacco cessation is completed. Patient states she has already reduced her smoking down to 1 pack a day, but wants to quit altogether and has a quit date set. Nicotine stomatitis has healed, and the menopausal gingiva stomatitis is healing as well. I recommend a 3-month recall for this patient to monitor bone level and maintain her periodontal status and arrest the disease progress. Home care recommendations. For prescription dental aids for this patient, I chose PerioMed. The patient has periodontitis and a high caries risk because of the xerostomia and her smoking. Over-the-counter dental aids, I recommended BreathRx and Biotine for her xerostomia and halitosis. I taught this patient the Bass method and instructed her to brush 2 times daily for 2 minutes. The patient also has an electric toothbrush so she can use the timer. I instructed her to gently brush with the bristles aimed towards the gums to making sure to get all the surfaces and to do this twice daily. I recommended Crest Pro Health for this patient, and the special instructions included were to brush twice, once in the morning and once in the evening. I recommended regular dental floss or floss picks for this patient, instructing her to floss once a day, making sure to wrap the floss in a C-like motion around the tooth and getting under her gums as much as possible. For interdental aids for this patient, I recommended a large proxa brush. This patient has large embrasure spaces and furcation areas, so I told her to remove the plaque and food by inserting the large proxa brush under the contact area, making sure to enter between the roots that she can see and clean those areas thoroughly. As far as mouth rinses, I recommended BreathRx and Biotine. The BreathRx because the patient still notes that she has halitosis, and the Biotine to relieve the xerostomia caused by her meds. Fluoride will be included in her Crest Pro Health toothpaste and also professionally applied every 3 months at her perio maintenance evaluations and recall appointments. The only product I recommend this patient should avoid are essential oils like those found in Listerine. Her tissue is still healing from her SRP and extraction sites. Nutritional analysis. With this patient having periodontal disease and menopause, some of the supplements that would benefit her oral health and overall health are soy, black cohosh, red clover, and omega-3 fatty acids. Some things she could add to her diet are for more alkaline foods like vegetables, fruits, seeds, nut, and yogurt, and also taking a daily dose of calcium. She should avoid and omit excess sugar, refined carbohydrates, dairy, spicy food, alcohol, caffeine, processed food, and fatty cuts of meat.